we mixed it up in rounds this morning and talked about gratitude. It was kind of a moment of reflection as a group, I think. Mm-hmm. And I opened up asking, what are the health benefits of gratitude? And what struck you about that conversation?
I think some of the benefits that people talked about were hormone regulation, where you have, when you put positive energy out or happy thoughts of love, gratitude, you can actually change the hormone balance in your brain. And then they also talked about regulation of like the fight or flight system. And I thought that was really cool, mm-hmm. that we can really affect our outcome by just being grateful.
Mm-hmm.
I've noticed when you just step back and take a break and get out of the grind for a minute and just appreciate what's around you, I think it just helps you overall relax, calm down, and gain a better perspective. And it almost re-energizes you to get back in and then work hard.
Yeah,
I agree. I had this thought when we were having the discussion of all of the things that we could prescribe to a patient that would give them benefit to their health. It seems like gratitude should be like the number one prescription.
I know.
It's kind of weird to say, but
yeah.
The profound health benefits are clearly there. And so it's a good week with Thanksgiving to just take some time to really think about what we're grateful for, and it can have a profound impact on our health. I shared a video of a surgery that we did that benefited from some advancement in medical technology, and we had a conversation about some of the technologies that have made an impact. What were your thoughts there? What technologies and medical advancements are you particularly grateful for?
My favorite, and it's in everybody's pocket all day long, is the cell phone.
Uh-huh.
Because what helps me the most is interacting and talking to people.
Mm-hmm.
And now all day long, I can just simply send a message back and forth. I can call people when I need to,
mm-hmm.
and I can get a hold of people that really are experts in their care and experts in what they're doing and are interacting with patients in a different way.
Mm-hmm.
We get to correlate with other treating providers with the same patient in mind. I've spoken to multiple different providers that have questions and give me feedback on patients that we've either referred out or that they're referring in. And it is just an amazing advancement that we have so much communication at our fingertips.
There's a constant stream of communication
mm-hmm.
anymore, which is wonderful.
I'm kind of mimicking that with electronic kind of stuff. The EMR, where you have the ability to pull up images right away. Patients get their images and you have access to them that fast, which is really cool because you're able to help someone where maybe a long time ago, you went through the process of developing them. When I worked in a dental office, we'd have to go and actually develop the film. So I experienced that firsthand.
Yeah.
But I think just being able to have all the information that quick, they do labs, you've got it right on your computer. We're able to help our patients faster than we were before.
What struck me about those comments was the dichotomy, right? Because on the one hand, we're grateful for cell phones and the ability to communicate, and with electronic medical records, the ease with which we can enter in data, retrieve data, and especially with imaging, review imaging electronically. On the flip side, it's been stated that the electronic medical records is a source of burnout for caregivers. Mm-hmm. And it seems like there's a conscious choice there in which perspective to have on these things. And yes, there's some downside, but at the same time, there's some tremendous advantages to what you've mentioned.
And I think that's true with everything in life.
Yeah.
It's a matter of just how you're looking at it.
Yeah.
The same thing can be perceived in multiple different ways. I like the idea, I think they're called ambiguous images.
Uh-huh.
You've seen the pictures where depending on what you see, the exact same picture can be two different things.
Yeah.
Right? Depending on who it is and how they look at it. The first thing that they see, there's the picture, I think it's of an Indian with a headdress. Or if somebody looks at it the other way, it's an older lady facing the other direction, if you know what I'm talking about.
Yep.
But it's the exact same item, but people see it differently.
Yep.
And I think that's the same way with our communication, with our EMR systems, with all of the updates in technology. It's a burden for some people. Artificial intelligence is a big one right now. And we'll always see that things are going to get worse before they get better. But you need to embrace these new changes. And if you're having a positive attitude about it and a positive outlook on things, then it's going to do good things for you.
Yeah, I agree.
Love that.
I shared a story that I'll repeat here. One of our patients has had a profound impact on me. He was backcountry skiing. He crashed. He was stranded on the mountain for several hours. He came in with spinal cord injury, several fractures in his spine, and he also had a really bad scalp laceration. We operated on him all night, and then he's in the ICU a few days into his recovery, facing a lot of proximate and long-term issues related to this. And the ICU nurses were able to take him outside during a snowstorm, and he was able to sit in a hospital wheelchair and just look at it snowing. And I asked him what his perspective was on that, and his comment was, and it was sincere, I think, I was just grateful to be there. Mm-hmm. And I've just thought, man, how are you that good of a person to just be through such a difficult thing and yet be grateful? And one of the things that I've reflected on is his gratitude and his perspective and attitude enabled him to heal. Mm-hmm. He does not walk, but he is able to do so many things. He skis, he bikes, he has a great life and is a great influence on a lot of people. And as we talked about stories from patients and the impact that they have had, it just really came to me that we have a tremendous reason to be grateful for the patients that we have an opportunity to interact with.
Agreed.
Yeah, I agree. And I think we'll take advantage of the time of having our boss with us right here, right? I think he displays the exact same characteristics, and maybe it's come through living through some of those experiences. Yeah. Because you probably have the same experience I do in the operating room, where it'll be a challenging case, it'll be a long day, and undoubtedly Dr. Edwards will at some point in the day say, "This is the best day ever." Which is great. It always is uplifting. It keeps everybody going. It's been fun.
I truly know whenever I'm going to be with you, I'm going to have a good day, because your positivity has been, I'm grateful for it. It truly has made my life better.
And I think everybody in our group has just exemplified that, just in every way imaginable. And it's been such a journey to be able to work with people that are positive, that see the best in others, that see the best in the situations that they find themselves in. And it enables us, I think, to make a more positive impact on the patients that we serve. So anyway, I'm grateful for the two of you, for all of the people that we have the opportunity to work with in our clinic. And this is like 5 years now that we've done the morning rounds. That's and so cool. Every morning I'm like, is anybody going to show up? And then there's like 40 people there.
Yeah.
And it's at 7 a.m. And there's no reason for them to be there. They're not getting paid. We don't, thanks to the Utah Medical Association, we can't even offer CME to them just yet. Mm-hmm. And we want to in the future, but there's no reason for them to be there except for they just want to be there and contribute to the conversation. And what a journey to be on. So it was good to just reflect a little bit on what we're all grateful for this morning. And I would like to just emphasize, we sent a newsletter out last week, and the response to it was tremendous. And a lot of patients responded, and some responded, I think, just quietly, but we're grateful for the patients that we get to have opportunity to get to know and try to help, and for their examples. Thank you to all of you, and I hope that everyone has a wonderful Thanksgiving.
Agreed. Happy Thanksgiving.